Hello, Facebook friends. It's Carla, your online doctor, with today's Live in 5. Today is Friday. It's May 17th at 5:03 p.m. Oh my God, thank God it's Friday. What a crazy long week, right? Okay, but this week we've been distinguishing between different types of medical options. I talked about energy healing. I've talked in the past about Chinese medicine. I talked about osteopathic medicine. Today I want to talk about naturopathic medicine. Hello, Tracy. How are you? Hi, Teresa. Okay, so in case you already weren't confused, hi, Slobodanka. So what is a naturopathic doctor? Naturopathic medicine is a system that uses natural remedies to help the body heal itself. It includes many therapies, including herbs, massage, acupuncture, exercise, and nutritional counseling. Okay, so it kind of encompasses a lot of different things. Now, naturopathy was brought, or naturopathy, if you want to pronounce the accent the other way, was brought to the United States from Germany in the 1800s. But some treatments are actually centuries old. They're not as new as the 1800s, okay? Today, it combines traditional treatments with modern science. Now, the goal of naturopathic medicine is to treat the whole person. Okay, the mind, the body, and the spirit. It also aims to heal the root cause of an illness, not just stop the symptoms. And to me, that is like an aha moment for people who don't realize that a lot of modern medicine, especially in this country, is treating symptoms. They very rarely are treating the cause of something, the root cause, to make it go away altogether. You're just kind of band-aiding it and putting something over it to make it kind of go away temporarily. Now, naturopathic physicians usually attend an accredited 4-year graduate level school. They learn the same basic sciences as medical doctors, but they also study nutrition, psychology, and complementary therapies such as herbal medicine and homeopathy. Okay, so again, they encompass a lot of different things. Now, some states actually require naturopathic doctors to become licensed. This means they have to pass a special exam to practice, and they need to continue their education. They need to take continuing medical education classes to maintain their licensing. Now, in some states, they can even prescribe medications. They can do minor surgical procedures, and they can actually even be trained in natural childbirth. So there's a wide range of what they can do, and it varies by state. Now, a naturopathic physician is not the same as a traditional naturopath. Okay, traditional naturopath does not attend an accredited naturopathic school. Okay, so they do not go through 4 years of education. So there is a difference. So you want to make sure that if you're seeing somebody that they have attended a 4-year accredited school. You want them to have as much education as possible. And if the state requires it, of course, you would like to see somebody who is licensed. Now, so one more area, what is integrative medicine? Okay, I was going to do a separate day on this, but I figured it's easier to combine the two. Now, there's also functional medicine. And what about holistic medicine? I kind of was getting confused myself. Are they all the same thing? Now, integrative medicine does just that, okay? It integrates conventional medicine with alternative modalities, which may include herbs, homeopathy, acupuncture, etc. Okay, they deal with diagnosis, but not necessarily root cause. Okay, so naturopaths deal with root cause. Integrative medicine just kind of puts the two, the East and the West, if you want to think about it that way, together and does a little bit of both. Now, functional medicine involves understanding prevention management and root cause of complex chronic diseases. Now, functional medicine it actually takes the best aspects of all models and offers the most comprehensive and effective approach to healthcare. Licensed functional medicine practitioners come from conventional medicine background. They can be MD or DO, and then they integrate over to functional medicine when they come face to face with serious chronic diseases and they're looking for long-lasting effects. They don't want Band-Aids. They want the long-lasting effects of treatments. So conventional medicine is better at acute illness, whereas functional medicine employs biology approaches within a holistic framework to find the root cause. Now, functional medicine treats the person who has the disease, not the disease the person has. Okay, so that to me was like, I'm going to say it again because it resonated with me. Functional medicine treats the person who has a disease, not the disease the person has. So that was one thing that always was something that, you know, we would talk about when we were in medical school. Oh, who are you going to see? Oh, I'm going to see the patient in room such and such with that. They lost their identity based on, first of all, we were just super busy. So people lost their identity. They became the disease. That room was the person with the such and such. And that is the exact opposite of what we should be doing. We should be looking at a person as a whole. That is what holistic medicine is. The whole person. Okay, and they happen to have a medical condition that can be treated, but you have to treat the person as an entire being. That's one reason why I am not a big fan of specialists. I don't want, you know, like if you go to see a kidney specialist because you have a kidney problem, and you go to see a cardiologist because you have a heart problem, and you see, you know, another doctor for this problem. None of them know what the other one is doing, and you're all getting prescription medications from everybody, but nobody's taking care of you as a whole person. So that is the whole purpose of a primary care physician, but usually their knowledge of everything is more superficial, which is why they send you to specialists. Not my favorite, okay? As an anesthesiologist, we have to know every body system. We have to know it all, okay? We may not be detailed in everything, but we know a lot more than the general practitioners. So this became something for me that I really loved, this functional medicine, the integrative, all the different things put together. And everything alternative is out there. So before you do anything, look for options, people, because there are many options out there. Okay, if you find somebody that is like in a naturopath, find somebody accredited, find somebody licensed if your state requires it, because why not? You want the best you can in the area you're searching for. So I hope this finds you well. I hope you guys have enjoyed your week. Looking forward to your weekend. If you missed my Wednesday night class that I did live on here, scroll back a little bit on my page and you will find it. I'm wearing like an orange top, sitting in a chair, and it's about 30 minutes. All about my love for Young Living and all the healthy options and stuff that I like to use. So again, I know some of you have been interested and have messaged me, and we've been chatting, and that makes me real happy. So with that said, I hope you guys have an awesome weekend, and I'll be back on Monday for another Live in 5.